Hello, everyone. Thank you all for your time today and welcome to today's town hall. We'll be talking about the coronavirus and COVID-19 again, trends, resources, and insights into the kinds of challenges our clients are facing. My name is Bobby Larson. I serve Holmes Murphy as the education consultant. I'll be your moderator. Before we begin, I want to go over a few logistics regarding the audio and web-based features of today's program. The only people you'll be able to hear during the webinar are our presenters and me. Any questions or comments should be proposed in the messaging panel on your screen. If your messaging window does not appear, click on the icon at the lower left corner that looks like a little conversation bubble. The presentation you're viewing right now will be advanced remotely, so simply sit back, listen, and watch. And if you have a question throughout the program, feel free to type it into that message conversation panel on the screen. And just so we can practice as well as see who's participating today, please type your name, organization, and the role you play into the messaging panel. We'd love to be able to welcome you today. Please note this webinar is being recorded to allow those who are not able to join us today to gain access to the material. I'm joined today by my Holmes Murphy colleagues. Rich Youngman is our fraternal practice leader, Mick McGill is the VP Client Service, Rob Mraz is the Associate Vice President of Claims and Client Advocacy, and Dr. Lori Hart is our Director of Educational Initiatives. You'll hear from all of them during the course of this town hall, but first let me turn it over to Dr. Lori.
Thank you, Bobby. I appreciate all these names coming in. I see a ton of people that return every week, and we appreciate that. I see some new people, and I jokingly said earlier, this town hall every week it's playing into my lack of ability to be on a stage and to develop content. So this week I might have gone over in trying to create a fun presentation for us. So Bobby and I did our homework this week, and we have listened to what was kind of said last week, and we appreciate the here's what we think we need. As we go through the town hall today, please use that instant messaging button, as Bobby said, to ask questions, but also if there's, hey, I wish I had, or hey, I wish I knew more about that, if you can just put that in the conversation, that really helps us gear what the client's needs are, which is our goal instead of guessing. So first thing, our friends, University of Iowa, I see Amy. Hi, Amy from University of Iowa. Every week we're starting to see a pop-up of an issue and it's a fraternity. I'm going to be honest, that's what we're seeing. That's the trend, but we're seeing people gathering. We're seeing people, as in this article out of the Gazette at University of Iowa. It was an unregistered event. Well, it's unregistered because they're not really in school, but they're gathering 30 to 50 people. University of Iowa is also an alcohol-free facility. And so we're still seeing these conduct cases. I would tell you, as we continue to see them week after week, this will only get worse. So if you have not discussed this as a national, international organization, a housing corporation, or I see some students on here, which is awesome. If you have not addressed how we're going to, and I hate this word, manage behavior, you need to address that. The national, international organization needs to think about ceasing and desisting in-person activities if needed, but this is going to be to continue the thing that we will continue to stumble on. A couple resources this week, I've removed some and I've just added a few, but we're going to come back consistently to our Holmes Murphy resources and let Bobby is going to jump in and tell us about a few new things that you'll see this week.
All of our coronavirus resources are at the top of the resources tab, resources for fraternities and sororities, all the recorded webinars and town hall slides. Last week we shared a new resource regarding things to think about if you've closed your facility as a result of coronavirus. We'll bookend that with a resource this week that can help you in the opening of your facility when the time comes. We also have a new resource based on recommendations for higher education from the CDC. Lori will be talking more about that later, so look for all of those to be posted this week. If you have suggestions for additional resources that would be helpful, please let me know and we can get to work on their development. But again, Holmes Murphy Fraternal under the resources tab.
Thank you. One thing I want to highlight this week is ACHEA, the American College Health Association. I've been watching them as we've gone through this and thinking about the partners and what the partners are saying. So this ACHEA will have a lot to say about recommendations and openings and what should happen. They really do have, they have weekly updates. They have a task force. They also have a ton of webinars that are on there, anything from around mental health to Just a ton of webinars. And so ACHEA, if you're just kind of saying, who do I look for? We're still going to say CDC, obviously, but this is also going to be a good place for you to look if you're just kind of checking things out. Also, a highlight of the week, I think a trend we're seeing is people are going to go viral for their conventions, conferences, and their summits. Our friends of EverFi have a Campus Prevention Network conference that they do every year, and this is viral or virtual now. It is 2 days, June 3rd and 4th. It's $99 to register. You're going to be able to come and go, pick and choose, but reduced cost. So you might think about this from the headquarters level of looking at the agenda, volunteers who might want to attend, staff that wants to attend. So they do great work. I'm happy to share that. So as we begin, the word of the week is football. If you are following what is going on, people are concerned about coronavirus, but they're also concerned about college football, depending on where you are in the country. Lots of people like to talk about football. So Sports Illustrated and many other news outlets had an article this week where Pence had a productive call with college athletic directors. So this was the national news, and this is from Sports Illustrated. And the word of the day was optimistic. Pence was optimistic, and he showed optimism. And as you get towards the bottom of the article, our friend Anthony Fauci was a little bit more like, well, I think we could play them in the summer in empty stadiums. So you start to hear a different, I think this plays into our discussion today. One person's going to say one thing, one person's going to say another thing. Who you're going to listen to, how are you going to listen to the information and make informed decisions. You are also seeing a little bit of divided information as it relates to the information coming out from universities, and this will continue to happen. Purdue University, President Daniels issued a letter. It is sitting on their website. And the last line of the letter, he said, it's unclear what course other schools will choose, but Purdue will employ every measure we can adopt or devise to manage this challenge with steady safety number for every member in the Boilermaker family. He was very clear in his message regarding fall semester that they would come back. He talks about 80% of the population is under 35. All data to date tells us that this virus, while it transmits rapidly in this age group, poses close to zero lethal threat to them. He addressed the 20% of people who are over 35 and people who have diabetes, asthma, hypertension, other ailments, that this will be a high-risk population, and they will have new policies and practice to keep groups safe or minimize contact. He talked as options about spreading out classes, days and time, online instructions for on-campus students, virtualizing library work. And then he talked about when we come back in fall, the options of pre-testing for students and staff, antibody stuff. Purdue has a BSL-2 level laboratory for fast results. Talks about anyone showing symptoms will be tested promptly, and quarantined if positive. Talks about the university is going to have space set aside. He talks about how they're going to look at frequent contacts for those who test positive, ask them to self-quarantine or recommend them to self-quarantine. So what you see here is a clear, confident message of we will be back, and here are here's our plan, the start of our plan, and what we're looking at. But then you see the next article, and the next article is not as robust. This is a news article. And so it kind of says two different things. It says Cal State Fullerton to start fall semester with virtual classrooms. If that is all you looked at on the article, you're like, oh, they're going just fall. They're going to be virtual. But then you'll see the next line. The university is going to ease restrictions as the threat of corona lets up. And so what the provost said there is, hey, this can change depending on the situation, depending on what happens. And the campus is going to look different. When they come back, masks, gloves, other protective gear will be required or highly encouraged. Workplaces and classrooms will be configured based on social distancing. Faculty and staff may be required to work on a rotation. So ironically, the article looks different, but it kind of says the same thing of, hey, when you come back, it's going to look different, and we're going to follow this. So if you've seen others, I'm happy to, I'd love to look at them, but those are just kind of the first two that popped up, and the Chronicle of Higher Education ran an article on those today. So here's what the thrust of the call is about, is people are like, we want to plan, we want to plan. As we think through fall semester, I think the 4 options look like this. There's a normal return, probably with some parameters to that. We're going to return later, we're going to return with restrictions, or we don't return at all. The NCAA kind of came out with their own plan after talking to Pence of, hey, we'll start football in September, a little bit later. Hey, we might start in October, or we might start in November, or we might do it in the spring. So everybody's kind of, the plan for fall is there is no plan. So, or there is no solution. So we have to think about the plan a little bit differently. Michael Goodman wrote an article, and I was just kind of poking around thinking about the idea of how do you make plans when there is no plan. But systems thinking is a thing that helps us expand the range of choices available for solving a problem by broadening our thinking, helping us articulate problems in new and different ways. At the same time, the principles of system thinking make us aware that there are no perfect solutions. The choices will have an impact on other parts of the system. By anticipating the impact of each trade-off, we can minimize its severity and even use it to our own advantage. System thinking, therefore, allows us to make informed choices. So I think instead of having one plan, we think of all the options, and then you kind of think through that system and what that looks like. Also, in poking around this week and thinking how to help and support clients, yesterday, admittedly, and maybe you've all seen this, I stumbled upon this, as I keep telling people to go to the CDC, I stumbled upon this interim guidance for administrators of higher education. They had last updated this to CDC on March 18th. And so Bobby and I were able to take this document yesterday. It's a 10-page PDF with lots of practical advice. Take this document, synthesize it, and really regroup this document to make it work for Holmes Murphy clients. So the key to this document, the key to what they're asking people to do is to plan, to prepare, and to respond. And in this 10-page document, you'll see kind of a decision tree, which is really a systems way of thinking. As we look at institutions of higher education, which we are a part of, the systems way of thinking is there's no community spread, cool, here's what we need to be doing, or there's minimal to moderate, here's what we should be doing, or there's substantial community spread. So this is the way that we are going to look at how we plan and how we prepare and how we respond in the guidance that we actually give you. So the plan prepare piece is the preparedness part. This is the idea of, hey, we're going back and we need to have a plan to go back. And so the first piece of this is really in this opening the facility, which is what you always do. Like, this is the stuff you always do. So I'm going to have Rob jump in right now and just really talk about the basics of opening the facility so we don't forget the basics in the work that we're doing.
Thank you, Lori. Opening a chapter house, again, as Lori said, the basics aren't going to change. There are some other things that you'll probably need to think about, and we've put together a resource that we'll be posting this week. But some of the big things here are really, looking at the picture here, and I've been speaking to some universities and corresponding with them. I think really the best thing you can do is think about, we're coming back, plan to come back if something, but be ready to change. But a big piece of that is your recruitment, right? Recruiting your current people to come back, start collecting those leases, and we'll talk a little bit about the leases and the contracts piece here, but you may need to alter that somewhat. Make sure that you've got your signed memberships agreements collected, that you're communicating with them, that the damage deposits need to be collected, that you're still showing your house rules. One caveat of that is that you're really going to need to think through, what do we do if we have an outbreak in or a confirmed case in our property, or, how are we going to clean? How are we going to quarantine? What are the steps here? We've seen that disinfecting through a professional service, which, is an option, can be expensive, and it can be ongoing, but you've got to be able to communicate that with your residents. What's our plan? What's our ability? Part of that is also communicating with the university, who I strongly encourage you to partner with in terms of isolations, needs for isolations. Many of the universities are maybe better equipped or already have a plan to help their students. They may be able to help you out. that's something that if you're communicating ahead of time with parents who are going to want to know this, and your tenants, your members, they're going to be open to it, rather than you have an infection, now you're trying to move them out of the property without communicating that ahead of time. They're going to start fighting you on the lease, because there are legal parameters surrounding that contract and you as a landlord that you probably got to consider too. But in terms of opening, I mean, you still want to make sure that your facility is safe, that your heat, power, all of your inspections are complete, going through that process and that everything's operational. You're still going to want to make sure that the premises is safe for passerbys or invitees, although you're probably not going to have many at this point. Make sure, as you're talking about cleaning, right now is a good time to start to, I don't want to say stockpile, it's kind of a bad word in the community, but you definitely want to start building your supply of ordering disinfectants and things that you're going to use to clean the facility regularly when you open. But these are all things that you need to be thinking through. And much of this will be outlined in our facility. The one thing I would tell you about trying to procure these supplies is that if you wait until the fall to get them, you're not going to find them, or they're going to be back ordered. I've personally ordered some chemicals that are on the N95, or not N95, the EPA N list, and they're back ordered. But you as a business, are going to want to order those in a larger quantity. So the sooner you start, the more likely you are to have those. They're not extremely expensive, but it is an added cost. And so these are things that you need to think through, and all things that we outline in this resource for you to be thinking about, and making recommendations as to how you can do this to minimize the impact on your business and the students returning. Lori.
Sorry, I was on mute. Anything else about contract language and the force majeure language and updating?
Yeah, so I think we have a slide. The next slide on 20 is the contracts, I believe. But one of the big things that you're going to want to look at is having a force majeure provision. And what that basically is it's a provision in the contract where if either party cannot perform their duties due to some act of God, so to speak, or something that's well beyond foreseeability, such as a war, insurrection, a pandemic, an outbreak, that it gives each party a reasonable opportunity to leave that contract. And right now, I think you're going to see more people interested in this because they're going to want their money back if they're paying it the full semester or a full year up front. And so this will allow you to spend time now to outline that for people, and also allow you the opportunity to let them out, or for you to say, hey, I can't fulfill my obligations because of the current situation. And part of that is going to require you to really talk to probably your national legal counsel or legal counsel available to you to draw up something that's going to work in your jurisdiction. I know we have some examples that we use. We always it's not legal advice, but it's always something that we can give you a boilerplate to take back to your local venue so that you can have that vetted by counsel that's going to work for your area. It's one, going to keep you hopefully out of legal trouble, two, keep you compliant with other requirements in your venue or jurisdiction, and three is just going to help address this so that you can better prepare, or your tenants can better prepare. Nobody wants to be caught off guard again going through this. One thing I am looking at is trying to get some university housing agreements to kind of see how the universities are handling this, so that we might be able to align our clients with some of that language, given that your housing is very similar, your operation is very similar to university housing.
Thank you. In addition to that, the opening of the facility and going back to the Purdue from the President Daniels, I think people need to see confidence in your approach to this. And so there is a note you will see in the Purdue letter of business as usual. So when you read that letter, you will, I think, hear the confidence, just even how he says to the people of Purdue, like that's how he opens it. But he's like, business as usual, and we're going to make accommodations. And so the opening of the facility resource that will be on our website, it's not going to look that much different because you still need to open the facility like you normally would. Nelson, to your question, do we need to request the boilerplate language to take to our legal counsel? This really is just a letter from the president to the people of Purdue. And it's, I have on the, you can just Google it, but it's sitting on their web page. As I go back, it's sitting on their web page if you just Google Purdue president. Oh, the force majeure language. Sorry, we do not have the boilerplate language for that separate thing. So no, we don't have. Rob's looking, as he mentioned, at other housing agreements to pull together a template for that. So in addition to the business as usual, I'm jumping back in now to our CDC resource for the institutions of higher education and what they are requesting. From the document of what we pulled, and Rob mentioned some of this, we have said this before, but we're going to say it again in case you're joining us for the first time. You've got to think about a plan in addition to business as usual, opening facility, how will you intensify the cleaning and disinfecting efforts? All of that information that is on this slide is in our resource, and it's directly from the CDC and what they are requesting. Also,
Hey,
what we are, yes.
Sorry to interrupt. There's a question here from Andy Longo, our statement about their counsel has recommended not using the term lease with students. One thing that I would offer to our clients is that we have prepared license agreements for our clients that you can use specifically between a house corporation and the chapter, or that they can be converted for use between the house corporation or chapter and tenants. The difference between a license agreement and a lease agreement is, generally speaking, a lease agreement gives you the right over the entire premises, where a license agreement gives you rights to use some of the premises or specific areas of the premises. And so the thought behind that is based on information we've received from legal counsel, is that you're not necessarily restricted under the same landlord type laws. That can vary some in your jurisdiction, and obviously if you would like a copy of it, you can get it from our website or other resources that we'll post, or contact us. But you can take that to legal counsel and have that vetted as well.
Great. This is something we continue to see pop up. I think our world will look different for a long time. And I think what will come of this is different hygiene practices. So some of the things you want to think about, I don't know if fraternity and sorority facilities are the cleanest. Some are, some aren't. I've been in various. So you're going to think about how are we going to reinforce our healthy hygiene practices. The CDC, they offer free hand washing resources that you will be able to download to put in the facility, the adequate supplies for the fall, and also we added creating hand washing stations. We're hearing that over and over again, as how do we have stations for people to hand wash or to wash their hands and also disinfect. So I think the healthy hygiene practices probably needs to sit in some kind of student committee, as well as the housing corporation, some conversations about what does that look like. And I want to reinforce, if the practice has always been new members play a role in the cleaning, you really need to rethink your cleaning, disinfecting, and the healthy hygiene, and who's responsible for that and how that works. Also, continuity of meal programs, that is in throughout the CDC resource and the Institution of Higher Education recommendations. kind of a no-brainer, but all of you do meals differently, so it's hard for us to say, do this. Some of you have companies that you're using. Some of you have a chef that is creating. Some of you don't have food. But throughout the document, the CDC document, they really, if I had counted how many times they said local health officials, I mean, I would have probably been at 50 or 60. They really are putting a lot of responsibility on local health officials and the guidance they are providing to the institutions of higher education. So whether you have thought of them as a partner or not, I believe that your local health officials will play a huge role in what the recommendations are for as they are consulting with the institution of higher education. So whatever food you have, you need to think about alternative ways to distribute that as you move into fall. And also, plans to communicate. Amy was on our call a few weeks ago from Alpha Zeta Delta and talked about what she had learned along the way. And one of the key things was, as a housing corporation, you might not have access to all the members and to the parents, but really thinking through your strategies for sharing information and who those partners are. The partners are going to be your national, international organizations. Your partners are going to be possibly your local health officials, your institution of higher education. I believe that universities will have a protocol in place. You will need to know what that protocol is. I am almost certain that they will. The key thing is in communication strategies, it's who is going to be the communicator and who provides the information. Saw some in their client that an organization who had put out information about the facility. Well, the sorority president just clearly disagreed with it. Now, I don't know if I probably disagreed with it too, but what she did was reply all to the parents, to the members, and said, I disagree with the national organization, but you have to do it anyway, and really created a lot of conflict. And I applaud her for using her voice, and it probably worked at some level, but it created a lot of chaos. So when you think about plans to communicate, you all have to be on the same page. The housing corporation, if you're saying one thing, the officers need to buy into that thing. You can't throw it on them, so there needs to be collaboration in that. And then who is the spokesperson for the chapter during this time? Stephen, I'm going to hold on to your question for just a minute because we're going to get there. And the next thing we've said over and over and over again, as part of your plan, hey, we're coming back. It might be late, it might look different, but what's the plan for the facility, and assuming that someone's going to test positive? You have to have a sick room and a separate bathroom for the individual, and that's the CDC recommendation. If you don't want this thing to spread like wildfire, you're going to want a sick room to place people. Is there a safer alternative? I believe that every university this fall will have some type of housing for those who have tested positive. You heard that in the Purdue statement from President Daniels. I cannot foresee a university that won't, but the question is, will they take a member who might live in our housing into the university housing? And you need to know that up front and have that plan. If the answer is no, you need to have a sick room and a separate bathroom. And you need to be ready to clean and disinfect that area. Last week we were on a call and we had a volunteer ask, do we have to? And I think that's going to be the question of fall, what is a guideline? This is not law. How do you enforce this? But at some level, you all are going to have to do the right thing. And the answer is going to be in the right thing. You're going to have to look at what the CDC recommends and think now about how you prepare for that. So to Stephen's question, if you have one member becomes ill with COVID, then all members of the facility have already been exposed. So all living members will be required to quarantine in the facility for the CDC and university guidelines. So isolation becomes a moot issue to some degree. Yes and no. I mean, I think a lot of us have been exposed, and I think, when people were coming back from Europe and they were told to self-quarantine, they weren't mandated, they were told, they were asked to self-quarantine. I think if a member tests positive, yes, they've already been living in that facility, and kind of a moot issue, but that person who tests positive is going to need to go to a sick room to mitigate. This is my recommendation. But I think partnering with the university on what that looks like, and this would be a key thing as you think about communication, whatever that plan is, I think members and parents need to know that plan up front, so when they're coming in, it's not thrown on them. If someone tests positive and your plan is, hey, you're going to go live in the university facility, but you don't tell them that till they test positive, it's probably not going to land well. So communicating that information, if, you know, for the safety of all of our residents, blah, 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 we're going to do this. Another question, Davis or Stephen, I know that doesn't answer the question. It's just there is a difference in testing positive versus being exposed. And so you need to be prepared, I think, to handle those things differently. One of the things I've heard, this is from Davis Millard, one of the things I've heard is that there is still a risk of spread even if in a separate room. Without a negative pressure room, spread is still possible since our facility won't have those. Is it still recommended to allow them to stay? Does this make any difference? Davis, we've been saying this all along, is who owns the decision. The problem with, not the problem, I mean, the great part about Holmes Murphy clients is everybody looks different, right? Like, we have a lot of clients who don't have housing. They're probably like really happy right now. Like, I got to believe if I don't have a lot of housing, I'm like, whew. There's some of you who have housing and national organization, you have properties and you are in charge of the housing component. And then there's others where, hey, we just provide guidance to the local housing corporations. And so the national organization, while you can't tell them what to do, this is where I think you need to step up and provide some real guidance and expertise. Yeah, this stuff lives in the air. We know it lives in the air. Spread is still possible, yes, but we also know it can be mitigated if those people are quarantining. Would it be ideal in my Lori Hart world if they moved out of the facility? Sure. And if the university is providing that, that would be better because they are cleaning and disinfecting, and we know that's happening. But you get to determine if they stay or don't stay. And that we will, ideally, if they could go to the university facility, yes, that would make the most sense. But if they can't, you're going to have to think through that sick room and a separate bathroom and also ongoing cleaning in that area. Are there any entities, AFA, Holmes Murphy, NASA, that are gathering information on which schools are providing housing for those that tested positive? Not to my knowledge. No, not to my knowledge. But we're still pretty early in the game, because as most schools are still preparing their plans. And then Stephen Jones, as of last week, Iowa State Residence Hall System had not discussed plans for isolation housing. Okay. I think I think everybody's discussing it. I think it's discussing it quietly and trying to figure out what to do. But if they are following the CDC Institution of Higher Education guidance, they're going to have a plan for that. So for me, as you think through a plan, assume they're coming back, but also assume, let's say, part of that systems thinking is in thinking through systems thinking or a decision tree, the university is not providing housing, therefore, what are we going to do? That's kind of this process of the systems thinking. If they do provide housing, what are we going to do? And it's April, so I think this is going to, like in the next month, this is where you're going to spend your energy, if I had to guess. So I'm going to point you again to the resources, CDC. On the CDC, this is going to be your best resource of what to do if you're sick, caring for someone, caring for yourself in the home, and disinfecting. This is where a plan every housing corporation or national organization should be looking at this and helping develop a plan or a template of a plan. I know there's headquarters people on here. Just from my headquarters way of thinking for 17 years working for a group, it would be useful, I think, to utilize this information and create a template for your groups based on how your housing corporation system works. And I'm happy to be a part of that conversation if you think that would be useful. If you're like, yeah, let's jump on a call and figure out what that might look like for our group. But happy to do that. Also, cleaning and disinfecting for households. I was on a call this week where, and I know many of you have been on many calls, and there's many people telling you many things. The group was recommending that you buy an electrostatic sprayer and decontaminate every week. I don't know if that is not necessarily our recommendation. Our recommendation is stick to the CDC cleaning and disinfecting for households, using the list in disinfectants, And that's kind of where we stand with that. And on last week's call, in an effort to not repeat ourselves, we certainly provided a list of questions for folks. If you think you need decontamination, what would be the questions that you would ask of a company who would be doing that? So that's the plan prepare piece. Again, this is going to pop on our website this afternoon or tomorrow morning as a resource, so you will be able to walk through that. We can certainly provide it to you in a Word document if that's useful to you. And then the response piece. Now, this is where it gets, it's pretty empty, I'll be honest. But this is where on our resource, if you have to respond, there's minimal and then there's moderate response level based on people who have tested. And so if minimal and moderate, it just pops up on your campus, what you're probably going to have to look at is implementing multiple social distancing strategies at that point, thinking creatively. You might return this fall and you're at a minimal. And so I think looking at large gatherings, how meetings are held in close contact, how people are eating, and how we should further scale back the dining services as far as grab and go still, self-serve stations, ice cream dispensers, things are going to be touched a lot. And then also consider ways to accommodate the needs of members and staff at higher risk of severe illness. I'd like to remind y'all, volunteers, even all of our volunteers and our housing staff, if they are older, you really need to think through this, and you need to think through underlying medical conditions and what's kind of the right thing to do in some situations. And then, and Stephen had another question. To some degree, a parent may decide that it would be safer for Johnny to live in an off-campus apartment rather than one in the chapter facility with 60 other members. Oh yeah, we'll need to factor that in. Yeah, and I think this is why you've got to think through your plan and your process and your system's way of thinking and approach it. I'm sure President Daniels at Purdue, making him the case study today, I'm sure he has that thought. Like, why would they live in a residence hall and not just get an apartment? I think we're all in that place of we live like cruise ship people. So would it be safer to live not like cruise ship people, to use a metaphor? So I think providing confidence, providing a plan, providing information that is CDC based will build confidence if people choose to live there. And then the substantial response, if this is substantial, lots of local health officials and universities are going to jump in and they're going to provide the guidance. This might be where we cancel in-person events, where schools cancel again. If you're watching today, CDC predicts this could be just as bad next year, if not worse, when the flu season picks up. I would love to believe this is the last time it's going to happen. I'm beginning not to believe this might not be the last time until we get a vaccination, which, could still be a year or 2 years out. So you need to think through not if this is going to happen again, but in a systems way of thinking when this happens again. What lessons did you learn this time? How would you do it next time? And go ahead and have a plan in place if you decide to keep your facility open and the university goes online, or if you decide university is going to go online and we're going to keep the facility open. You need to have that plan ready based on all the information that we've been providing you, and think through what you would do in that. But there's also, again, the basics. There's all these new things to think about, but there's also the basics. We have provided a resource on our website around that, and I'm going to let Rob kind of touch on the closing the facility and the importance of that.
Thanks, Lori. When it comes to closing a facility in this time, I mean, all of the main things that you would do at the end of a spring semester or winter semester are going to be in place, right? You want to make sure that unnecessary appliances are unplugged, extension cords are unplugged, that you're trying to fireproof the property as much as possible. As we get to the winter months, it may be necessary to drain water systems if you can, if they're not hooked up to a sprinklers system, where you can winterize the property to prevent a freeze claim. Closing a property during COVID-19 outbreak, this pandemic has really enhanced or shown a light on the need to really consider inspecting the facility from time to time. Empty properties present a greater risk for more severe claims. Essentially, if a pipe bursts, it could run for days before somebody sees it. We've seen claims where water is pouring out of the front of the property. That's the first alert, is when the fire department's there kicking in the door to go in and shut the water off. Storms, the spring, we may not have freeze claims right now, but storms can present, especially with the severe weather in some regions of the country right now. Trees falling, tornadoes ripping off shingles, high winds, hail damage, those types of things. So it's really breaking windows. It's not, or squatters or vandals are posing a greater risk if they're looking to see an empty property and an opportunity to see what they might be able to find. So it's important to really look at, we're not recommending that you go out and buy a security system, but if you have a security system, is it monitored? Are we looking, is it up to date? Is it functioning properly? Are we getting notices, or are they going to a dispatch central location where they're dispatching the police department? It may be a matter of, notifying the university police so that they know to drive by, or you can ask the local police department to let them know that, hey, our facility is empty right now. Do you mind just stepping up your drive-by? So I think closing the facility really remains the same. Nothing has changed. The big thing is, though, there's that added step that you really want to try to just make sure that the facility is being looked in on and that there is some maintenance going on. We don't know for sure, how long this is going to go. The carrier has agreed to not consider these properties vacant, but the longer this goes on, the greater the risk is posed to your facility. So, it's an asset. You definitely just want to protect that the best that you can. And we've got additional resources regarding the closure of the facilities due to the outbreak that can help you kind of think through some of those added steps and what you might want to do. And we recommend that you go to the Holmes Murphy Fraternal webpage and review those. That's it, Lori.
Thank you. All right, are there any questions? Any questions? Any you haven't answered this, or you have answered this, or can't wait for the resources, or I need more information on XYZ? If you'll just take a minute to put those in the message box, we would appreciate it. We have 11 team members from Holmes Murphy on here. I want to thank them for being here. So lots of people to answer questions if you have them. As we were doing a team roundup before this, we've committed to kind of doing these town halls for through the end of April. So we have one more next Friday. We will commit to do them as long as you need them, want them, but after next Friday, so we're not repeating information to people. We're probably going to rethink of maybe doing one every 2 weeks, or we actually like the town hall, so we're talking about doing one indefinitely once a month, just for people to circle up, because it's a good way to share information and to answer questions. But next week we'll do one more, and then we'll kind of rethink what everybody needs after that. Nelson said, who should I email to be listed as a contact from our organization? I'm getting invites from a legacy contact. Email Bobby Larson on the screen right here at the bottom. And Bobby, somebody else asked, can I have a copy of this presentation?
I've already gotten several emails from people asking for copies of the presentation. So I will share them as soon as I get the most recent version from you, Dr. Lori.
Excellent. My inner speaker self thanks you, all of you, for wanting to use this information. Any questions, any resources needed? Good of the order? All right. Well, we appreciate all 73 of you being here today very much, and appreciate the new people, appreciate people who continue to return and hear from us. So thanks for being here. If you need us, we are here for you.
And just a point of clarification, our next town hall is Wednesday next week, the 29th at 12 Central, 1 Eastern. And the information will be available on the events tab of our website, holmesmurphyfraternal.com.
Thanks, everybody.